Hi, I'm Paul DiLorenzo, and happy Cinco de Mayo.
Um, sorry, I'm,
Are you seeing my screen?
we are seeing your screen.
Okay. So today we're going to talk about air pollution and health. I'm a cardiologist based at Inova Fairfax Hospital at this time. I've had a long interest in climate change, and I've had a more recent, over the last 10 years or so, interest in air pollution, and an even more recent, over the last 3 years or so, some interest in data centers. The interesting thing about air pollution, as you can see, is it's the number one cause of pollution-based mortality, about 7 million people worldwide. It affects the young, it affects the vulnerable, and the elderly. It is uh, a disease mostly of the vascular tree, so heart attacks, strokes, um, and other cardiac events are uh, frequent as a consequence of air pollution. Uh, Although also, of course, lung cancer and lung disease. And then finally, it has a significant negative global impact. So I'll try to go through disease burden. I'm not sure if you've heard of the exposome, but I'll mention that. I will also go through some research results where if you put your hand up, you can make me stop. The air quality index, greenhouse gases, and breather's disease. I have one terrible slide on approaches, but I can expand on that. So this is the exposome. So the exposome is everything that happens in our lives to give us bad health, in a sense. It's all the things we're exposed to. So in the middle, you can sort of see the general, the internal. Do you see my pointer, by the way, Chris?
Yes, I can see it.
Oh, great. Thank you. So, right. So you get certain genes, you get your gender, and obviously most of the genes stay with you until you're born, but you also could be born prematurely. Then you have an internal um, exposome, like diet, physical activity, chemicals, PFAS, um, pesticides, and chemical pollutants and toxins. And then finally, you have this external um, uh, and both specific and general environment, and that's climate change, urban versus non-urban locations of living, social stress, economic status, how, whether you get seasonal depression from long cold winters in Trondheim, Norway, or something like that. So anyway, all that is what affects us and affects our health in the long run. And we now give that a name, the exposome. So this is just some look at cardiovascular disease and uh, some of that exposome uh, externalities. So air pollution on the left with multiple air pollution chemicals, climate change. And one of the things I like about this paradigm is that I consider climate change in and of itself an endpoint when pursuing patient health, particularly on a societal scale. Uh, if you look at everything that's happening now with wildfires as becoming actually the major contributor to PM 2.5 in America, more or less, it is a problem. And then the chemicals I was talking about and toxic metals, unfortunately, often in fish. Um, So they have the State of the Global Air report in 2025, and this essentially suggested that about 7.9 million deaths were attributed to air pollution in 2023, about 1 in 8 deaths worldwide, and about I don't know, 60 to 70%, so 4.9 million deaths were PM 2.5. So PM 2.5 is the big target. If you look at the air quality index, most of the harm that comes from that is the PM 2.5 content. And indeed, some experts argue we should get rid of the air quality index and call it the PM 2.5 index, which I've decided to call the POX index, which I guess it could be confusing though. About a third of people are exposed to the least stringent target by the World Health Organization, the IT1 of 35 micrograms per cubic meter. About, I think, at least 90%, but perhaps more, is exposed to above the lowest limit for sure. I think it might even be 95%. And if you look at countries in the world with this little map, you can see Africa, the Middle East, India, Bangladesh, etc., are some of the most exposed parts of the world. So it does have geographical predilection. And then finally, many people forget that dementia is attributable to air pollution, and it's quite a burden, actually. So health consequences, if you look at it, the air pollution is particulate matter, which again is the biggest issue. There's 2.5, 10, and ultrafine. There is smog, there's nitrates, and sulfites. And again, I like to think of climate change as part of this. Forest fires will increase PM 2.5 and have their own casualty and rate of dislocation. Floods, unfortunately, things like Mystic are problematic. Hurricanes, typhoons, and cyclones are all the more frequent and catastrophic. Sea level elevation, heat, so heat-related death and disability will be more problematic in the future, and changing infections. And it also affects our life. So this is the 23 ranking of the leading risks for basically causing death in the future. So in the past, particulate air pollution, oddly enough, was number 1, and it's dropped down to number 2, interestingly, and high blood pressure is somewhat greater. But you can also see many risks, attributable risks to in a rank, such as low birth weight, high BMI is pretty high up at 6, high LDL cholesterol at 8. These are sort of my diseases. Diet low in fruits is a big 13. Diets high in sodium is 18, and diets low in vegetables is 25. So unfortunately, many of these diseases, which are environmental and occupational risks in red, behavioral risks in blue, and metabolic in green, by the way. This once again localizes things and also uses the sociodemographic index in quintiles to segregate what different groups experience. So if you're a low sociodemographic index or low middle, that's where PM is, or particulate matter is big. If you're middle to middle high, then particulate matter is only second. And if you're high, then if you have a lot of money, essentially, then it's number 5. You can see some of the other risks. And again, it is geographic. Most of the problems occur from here in Africa out through the Middle East and South Asia particularly, and then Southeast Asia. And I'll skip this one. I think I have this elsewhere. Again, some of the diseases that occur, cardiovascular disease is the biggest part of it, with stroke, hypertensive disease, and ischemic heart disease, diabetes, cancer, and chronic disease. And many of the levels for PM 2.5 have gone down. You can see somewhat in America, but more recently in China and India due to some of the programs. Basically to reduce coal burning, particularly in China, and get solar in. And then you can see there's a dose response curve. It starts at a very low level, but somewhere up around 200, 250, it starts leveling off for stroke, and it's a little bit unclear where it goes for ischemic heart disease, whether there's a plateau. But it's important to remember that there's no safe level of PM 2.5. The risk accrues all the way down towards 0. And again, PM10 is this coarse particles that come from the silicon, aluminum, iron, and calcium of the Earth's crust. The road kind of burns them off. It can also be sea salt. PM 2.5 I like to refer to as fine, and it's usually incomplete combustion. So in many parts of the world, they use wood ovens or wood stoves. That's terrible. The stove, burning wood in your fireplace is not good. And also diesel vehicles, tailpipe emissions, and then the rubber scraping off. And in China, they showed a huge number of heavy metals in their PM 2.5. And then there's the PM1 that is, again, one of the forgotten ones particularly, and that's also some of the same things: diesel, soot, and nitrogen and sulfur oxides. And then the ultrafine is PM 0.1, and that's obviously even smaller. So the PM stands for microns. So PM10 will pass through a 11 or a 10 micron hole. 2.5 will go through a 2.5. 1 will go through a 1, etc. And if you look at the human hair, a PM10 is about 1/7 the width, the PM 2.5 about 1/30th, and ultrafine is about 1/400th. PM 2.5 is about the size of a red blood vessel. This shows a graphic of it. I think I've already gone through that. This shows another graphic of even down to coronavirus, which is 0.1. So coronavirus would essentially be the ultrafine particle, and bushfire smoke and tobacco smoke is between 0.1 and 1 micron. So why does that matter? So coarse particles get into our body through the respiratory tract, but they have a hard time sort of going all the way down. 2.5 goes way further down, and then also crosses into the bloodstream from the alveoli, and obviously PM1 and PM 0.1 even go further. And so what do these guys do once they're in the bloodstream? Well, they cause all sorts of oxidative stress, inflammation, they trigger neural arc reactions, and they get into problems with receptors. They have various intermediates. They cause autonomic and endocrine disruption and dysfunction. They ultimately cause endothelial dysfunction. That's the inner layer of the blood vessel. They are hypercoagulable. That means they makes it likely you'll get blood clots in the arteries and potentially veins, I suppose, although you don't hear as much about that. And then oddly enough, they cause hypertension and type 2 diabetes. So there's a thing called a vulnerable plaque. That's when you have a blockage in your artery of the heart or anywhere else in the bloodstream, as you see sort of here, and all of a sudden it ruptures like a volcano. PM 2.5 is one of those triggers to cause this. So that also leads to heart attacks. Heart attacks lead to cardiac fibrosis. That in turn leads to heart failure. Obviously, any heart attack or unstable heart coronary syndrome can cause death, can cause stroke, and can cause arrhythmias, some fatal. So this is from a pollution in the heart article. So you can see it's very cardiac centered. In the New England Journal of Medicine, Raja Gopalan. So going back to the old evidence, this is the 6-city study. It was done by Pope and Dockery, and it was written up in 1993, and they followed 8,111 people for 14 to 16 years and looked at different cities. So this is Wisconsin, this is Topeka, Kansas, this is Massachusetts, St. Louis, Tennessee, and the unfortunate Steubenville, Ohio. And up top here is the levels of their PM 2.5. So Steubenville was almost 30, and this was in the past. And what it showed is that relative from here to here, there was a 26% excess mortality, and that was attributed to this air pollution, again, dominantly PM 2.5. This shows the Kaplan-Meier curves for survival, and basically people in Steubenville had a higher rate of death. That wasn't like they all died. This goes down to 25% death rate at the bottom here. But anyway, they were more likely to have a mortality than people in the clean cities. They also looked at the relationship of smoking. So it was noted, and it was even noted well before that, that air pollution caused lung cancer. But interestingly, if you were a current smoker, that was an 8-fold increase. If you were a former smoker, it was a 2.5-fold increase. Similar for cardiopulmonary disease, there was a magnification of the risk here up to 2.3 risk ratio by current smokers and 1.5 by former. And it tended to have a significant effect, a doubling in current smokers and 39% relative risk increase in former smokers in all-cause mortality. As we saw here, went the wrong way, the general population, it was only a 26% relative risk increase. And this goes through all the different causes. Again, 37% for cardiopulmonary, 37% for cancer. Interesting, other causes of death were not significant, and the correlation was PM 2.5. And so they concluded that this air pollution and PM 2.5 had contributed to excess mortality in U.S. cities. They also noted some contribution of sulfates as a risk. And then finally, they did long-term follow-up, and the most important is this 2012, where they noted that at that point, per 10 micrograms per cubic meter PM2.5, there was approximately a long-term 14% increase in all-cause mortality. So this led ultimately to stricter EPA standards, and the first ever EPA 2.5 standard in 1997 saves hundreds of thousands of lives. And it reinforces the idea that the life expectancy difference between the cleanest and dirty cities, at least in this study, was about 2 to 3 years long term. So what about the American Cancer Society's Cancer Prevention Study number 2? So this also looked at per 10 micrograms per, or microns. Microgram is a micron, by the way, per cubic meter increase from, in this case, say 10 to 20, you get 4% increased all-cause mortality relative risk, 6% cardiopulmonary, and 8% lung cancer. Again, establishing the PM2.5 is the big gun for this, so to speak, metaphorically and literally in a sense. And then here's the another, for whatever worth, this is kind of a gratuitous slide. If you look at add-on data, we already talked about the environmental, but also obesity and cancer risk, lifestyle, where people who have nutrition and physical activity consistent with the American Cancer Society have a 24% lower risk. And then also secondhand tobacco use, which had a 20% higher coronary heart disease mortality risk. And again, we all know all this. We all think it's well published and all that. But back when this was front page news. So what about lung development? So this looks at people who lived in Southern California, where there was a lot of smog. Smog, as you know, is contributed heavily by ground level ozone. So in the stratosphere, it protects us. In the troposphere, i.e. on the Earth's surface, it sort of kills us, or at least destroys our lungs. So they had kids going from 10 to 14, and about 10 to 14 or 15, I'm told, is when the lungs develop. So many of these kids developed asthma more avidly, and they had problems with their lung development that ultimately led to deficits in their forced expiratory vital capacity as they reached adulthood. So the idea is that once you got that exposure as a kid, you were done. You were always going to be at a disadvantage with your lungs. And then finally, they also showed some bronchitis and it was also noted if you moved to a different area, you did better. And some of the problems never occurred while you were a kid. This was a Medicare population in 2017 that was studied, so only 61 million people. And this showed each 10 micron per cubic meter PM2.5 was associated with about a 7.3% increased risk. So again, we usually say about a 5 to 10% risk. This was a European trial that showed a 7% hazard ratio for relative risk for 5 micrograms per cubic meter. Again, it also noted that hypertension was linked to PM2.5 and nitric oxides. And you can also see down here at the bottom that noise was an issue. And see if it's on the next slide. Yeah, here, it might be here. Right. If you were pregnant and you were exposed to air pollutants in traffic, this resulted in low and restricted fetal growth and ultimately low birth weight. So anyway, they suggest that unfortunately it's a disadvantage to be right next to a busy traffic area if you're pregnant with a child. And again, traffic density on the nearest street, and this is for 5,000 vehicles per day, was about a 6% increased risk ratio relatively of low birth weight. So this is the state-of-the-art review. Actually, this is the first one. It just also shows that total air pollution, pollution is sort of, air pollution is about as much as all these others put together. So only smoking comes in. And again, they note that they quote an interesting study that showed that if you have acute exposure to high PM 2.5, your blood pressure goes up 1 to 3 millimeters of mercury over the ensuing 2 to 3 days. Usually the effects of PM 2.5 are seen 2 or 3 days later. The diabetes, relative risks of diabetes can go up upwards of 39%. And then there's also this short-term study that looked at heart attack, and in short-term PM 2.5 increased heart attack by 2.5%, stroke by 1%, heart failure, death, hospitalization by 2.1%. And there is some controversy about AFib, but I think it does seem to have a mild risk of it in some studies. And atrial fibrillation is a cardiac arrhythmia with an irregular beat, regular rate rather, that can result in stroke and heart failure. So what about PM10? So PM10 is kind of the bigger particles, and you don't hear a lot about them. But interestingly, this is sort of a meta-analysis that was updated for the WHO World Health Guidelines for 2021-ish. And what it really showed was that there was a high degree of evidence for increase in all-cause mortality, and with 2.5, of course, and the relative risk ratio was 9.5%. But interestingly, if you looked at PM10, there was also a high degree of certainty, and that was 8.1%. And it's similar for most of the parameters, maybe not quite as striking with PM 2.5 as with PM10. But guess what? If you have PM10, some of the stuff in it is the smaller particles that could get through. So there will be any PM10 that doesn't segregate will have some PM 2.5. But in any case, it is a risk, although it's not talked about. So what about PM1, the 1 micron particles? So basically, they looked at ER visits, and what they showed was there was a relationship with increased ER visits in cities with PM1 of 42 microns per cubic meter and 2.5 of 52 microns per cubic meter. And for every PM1 rise of 10, the effects again occurred 2 days later, and there was a cause-effect association of about 4.8% for the PM1 and 5% for the PM 2.5. But what this means, and remember, a lot of the a large amount of PM 2.5 is actually PM1. More like, I'm going to say 60–70%ish, maybe more, depending upon how you count it. If you count it by particle size or weight, that actually most of the health effects of PM 2.5 actually come from PM1, which is revolutionary. So why don't we use PM1 more? It's harder to measure. That's one easy answer. And in any case, they also showed it's bad for your lungs in a study from Northwest China. And yeah, it's about 75–90% of the particle count, 50–90% of the weight. It's a sub-fraction of PM 2.5, and even though it seems to have a good accuracy, it may be that PM 2.5 is a reasonable surrogate by and large. And you can reduce PM1 by walking, for your society, walking, bicycling, taking trains, etc., using EVs or hybrids, not having diesel powered equipment like generators. And they also recommend checking air quality index. And these also go for 2.5, by the way. Limit cigarettes. Cigarettes generate 2.5, by the way, as well. And avoiding fireplaces, scented candles. In Germany, they air burp, house burp or lüften. So house burping is a practice of opening the windows for 10 to 15 minutes a day to exchange the air. That works best if the air quality index isn't too high. And air purifiers can be useful, probably best in the room you spend the most time in, like a bedroom, by the way. So ultrafine is PM 0.1 micron particles, and those also appeared to cause lung disease. And they also had health effects, basically increased emergency room visits. And other particles are linked to dementia, but so is PM 0.1. And it's a linear, kind of flattens out, then goes back up again. And the risk ratio is not huge, but for Alzheimer's, it's about 1.6%, and for 2.6%, and for all dementia or Alzheimer-related dementia, I believe, or AIDS, it's 1.6%. And oddly enough, the risk in China, I believe, this was from, actually it looks like it's USA, sorry, was higher in rural than urban areas. And so ultrafine particles are considered neurotoxins. So what are our air quality index standards? World Health is less than 5 microns per meter squared, or meter cubed. That's a hard act to get down to, and few places have. And there are interim time periods where places are allowed to get to that. Those interim time periods are not well specified. And then USA, we dropped it from 12 to less than 9 is the new 2024. And there are also standards for the other gases, many of which are in the air quality index. And this goes through the World Health Organization air quality guidelines. And it just shows the 5 I'm talking about here. Shows PM10 has one, ozone, nitrogen dioxide, sulfur dioxide, and carbon monoxide. And they say if just by getting it to this interim 1, which I think is 35, by the way, that would save 300, I can't quite read it, but I think it's 300,000 lives annually. And this is the EPA air quality index. And you can see they give a PM of up to 9, that's good air. 9 to 35, moderately severe air. 35 up to 55 is unhealthy, et cetera, et cetera. They also use the air quality index value, which is 0 to 50, 55, 51 to 100, et cetera, et cetera. And finally, they note the changes here, what they've done. The last is that it's exercise in high air quality index environments is actually detrimental to your health. It is hard to believe. So most people should not exercise outdoors where the air quality index is above 100. And many people, more sensitive folks, may want to consider that if it's above 50. And unfortunately, that proved true for those children in the University of Southern California trial, where they were exposed to pollutants and that actually harmed their lungs by exercising. Kind of a sad state of affairs. And this sort of goes through what I just said. Sorry. This looks at the high-risk areas, which are clustered around India and central China to some extent. And some of us use air quality indicators. This was from February 26th. And you can see that we had a bad day. PM was 9.6 in DC. I don't actually live in DC, I live in Arlington, but that was worse than usual by significantly. And it was an average day in India, 175. Usually in the winter, it can be up around 200 there. And this is specifically Delhi, I'm sorry. So everything's relative. Briefly, do you want me to talk about greenhouse gases? Probably not. We need to worry about carbon dioxide, methane, and nitrous oxide. So methane and nitrous oxide trap more heat per molecule than carbon dioxide, so they're more potent, but some of them last in the atmosphere a shorter period of time. And this actually goes through all that in one little slide. It shows that the carbon or global warming potential or carbon dioxide equivalency for methane is around 21. I've heard it higher. They give nitrous oxide 310. I've heard it closer to 200 as well. But anyway, all of these PFCs, et cetera, and particularly sulfur hexafluoride have very, very severe global warming potential. Some of this can actually be a process through data centers, by the way. However, they have different atmospheric life spans, which are estimated.
And so no sort of truce.
I'm sorry? Was there a question?
I just hoping someday we can get back to life that we had before data centers. And don't get upset. Just
sure. I mean, I think we hope for a better environment and better health for ourselves, our children, and our grandchildren, for sure. Anyway, many people say methane is a low-hanging fruit of climate change, because if you can reduce methane, the effects on climate warming will go down rather quickly. Whereas if you wait for carbon dioxide, you're going to be waiting a long time. So even though this is less potent, it is more enduring, unfortunately. Nitrous oxide is a horrible mix of the two. So, you see all these death certificates, right? But nobody ever has a death certificate that says air pollution, right? Usually you have the main cause of death, other causes contributing to death. But there is an exception. So there was somebody in London, a 9-year-old girl who had had asthma attacks because she lived in such a highly polluted area of southeast London, and the UK government coroner ruled that air pollution was a significant contributory factor to both um, uh, the induction and exacerbations of her asthma, which ultimately caused her death. So he listed it as a 1C exposure on the death certificate. So now you know it can be done, and it may be done. But remember, the risk of air pollution is an attributable risk. So it's difficult to tell in X individual if it's a factor, but it's pretty easy to tell in 1 million people. And again, there is this new disease called breather's disease. In Delhi, lung cancer is not always in smokers. They note that 70% of their cancer patients in Delhi are non-smokers. Among those under 30, none of them have smoked. In 1998, 90% were smokers. And they now see patients in their 20s being diagnosed. This particular doctor had seen a patient at 24 years old, non-smoker, who had lung cancer. And that's tragic. So why could that be? Well, because if you grow up in Delhi on an average day, you're smoking 9 cigarettes from the day you're born, actually from the day you're in utero. And as you, under certain periods, that may be as many as 30 cigarettes a day. So you're a heavy smoker. So this is called breather's disease. So in my personal view, we all have lost years of life due to air quality index and air pollution. I guess that's a typo, but in any case, so we all have breather's disease now. Some of us have it very mildly and it doesn't impact us, but obviously in Bangladesh with and there's a shortening of life by 5.5 years, in India by 3.5 years, and all these countries as well. We are over here, but it's not as big a deal because our PM 2.5 levels are lower. So what can be done? This might actually be my last slide. Sorry, I was looking for a better one than this. And this is prevention. Check your phone. See what your air quality index is every day, and choose to not exercise if it's above 100. You can potentially exercise in a gym or at home if you have a mat or something. You could also bike, walk, or use public transit. There is some controversy about bicycles getting pollution as they go through traffics, and that is a risk. Opening the car window, particularly in a city, is a pretty big risk. Don't idle your vehicles. Here's down toward here, limit intense activities. Avoid local burn bans, and sadly, consider indoor alternatives. And that's it for my standard slides. So what I mean by that is that if you have questions, I might try to go through a couple of them, but I might go back to that set. But if not, I'm done. Any questions, guys? Was that helpful at all?
Very helpful. And thank you very much. Yeah, we should do questions. I know I have a couple, but I don't want to jump in front of anybody if y'all have questions.
I have a quick question, Dr. Paul. So is there any way that a study would be done, say, in the Northern Virginia area to see how data centers are affecting our population specifically?
So I don't know the answer to that. I think it could be done. The fellow from UCal Berkeley looked at that partially. And he suggested that data centers were more harmful than we thought. So part of the problem is that we take up a third of our energy from outside Virginia, largely from West Virginia. And apparently there's a bunch of coal, some relatively clean, some not, being burnt in Marion County. So apparently Marion County is dying of our data centers. And oddly enough, there's a draft east to west, and that draft takes a nice course through Loudoun and for sure through Fairfax. So we also are having consequences of the air pollution. And the last is how little is it? When JLARC looked at it, they seemed to minimize the health effects of data centers, both on human health directly and on climate change. And so I think some of that is being revisited, if that helps you at all, Amanda. I think that'll change to some extent. And right, I'll stop there. Okay.
Yeah.
Does that help? Mm-hmm.
It definitely does, yeah. And then a follow-up question. So some of the statistics that you shared, especially about the effects on children and young people, are really, really heartbreaking. Have you seen anything like when presented with these statistics that makes decision makers, like policymakers and stuff like that, change the way that they interact with pollution sources? Like, did you see any of that in your research?
So again, I'm not a good policy person, actually.
Yeah.
I'm just more the science. But I would say that in my experience, lawsuits and harm to children catches everybody's attention. And so you would think that would be important. And the other outcome of that would be things like how a person in their own life with their own children manages that risk. And anything I said about being thoughtful in your pursuit of activities goes double for that. So I know this is a strange thing to say, but I've never lived on a busy road. I've never wanted to live, particularly since I had kids. I was always afraid they'd get run over. And then as time went on, I had different worries. And the other is fireplaces are not the best idea. We should get rid of gas stoves. And finally, we should think hard about swimming pools, which have a pretty high attributable risk as well, by the way. Anyway, sorry.
Oh, that's news to me. Minor clarification, if you don't mind. Most of your slides were in raw PM 2.5, except for the ones where we were talking about the AQI specifically, right?
Right. Again, I did try to go through PM10, PM1, and PM 0.1. And whether they really matter or they're just a concept is hard to say. Again, because if you lump PM 2.5, it'll obviously include the ones and the 0.1s. And, to some extent, PM 2.5 and 10 probably associate together frequently.
Makes sense.
Chris, this is Bob Kitchen. I just put something in the chat from an email I got a few days ago that says that DEQ has received some funding to start air quality monitoring around data centers.
I saw that.
It actually talks about a map or something, but I haven't drilled down on that, but just an FYI.
Yeah, I have that link actually. I can put that in the I'll put that in the chat.
I saw that as well, and they'll be putting monitors in different areas, moving them around. And I'm pretty sure they're PM 2.5. They might be a nitrous oxide as well. And there might be a couple more in there. But yeah, I think that is, as we say, a great start. In a sense that, Amanda, that answers your question to some extent.
Yeah, I mean, clearly enough of us raised a concern that this got off the ground. So that's good to hear. And I'm sure attributable in some degree to the medical community too, because I feel like as environmentalists, when we talk about like destruction of the environment, we don't get as much movement as when we talk about health impacts.
I agree.
Anybody have any other questions before we adjourn?
So, Chris, you had kind of asked me a loaded question, and I thought I would give you an answer to it. Let me see if I got it here. These are CO2, nitrous oxide, and methane. They're all going up. Let's see, this was our assessment. So you asked about 38.2 tons of PM 2.5. So a large contributor to PM in North America now is from our frequent forest or wildfires. And so, are you seeing this, by the way? Are you seeing my slide?
No, you're not sharing your slides at the moment.
Let me see if I can do that. I'm so sorry.
No worries.
Getting away. Where is it? Here it is. Oh, here it is. So anyway, and for example, the 2023 Canadian wildfires you see down here released 9.8 to 15 million metric tons, so a metric ton is 2.2 tons, I believe, of PM 2.5, more than 10 times the U.S. annual wildlife output for 2025. So if you think about that 38.2 tons of PM 2.5, and you think about certain fires in California, like the Eaton fire and the Palisades fire, so those were about 5,000 metric tons. I think it was 4 to 7 or 4 to 6. And then this was about 6.5 to 8 or something for the Palisades fire. But if you simply divide that is equivalent essentially to about 0.76 or about 0.75 of a percentage point of a relatively large Californian forest fire, and about 0.5% of a slightly bigger fire. But when you get to the really big fires, you can see, so this is 10 times more or less as big as this. So it would be, 0.0176. So it would be quite a small percentage, but still a meaningful one. So anyway, if you think of this in terms of forest fires, okay, it's not a big forest fire, and it's not even a medium one, but it's, a part of it, a little bit between 0.5 and 1% potentially. So it's a meaningful amount of PM 2.5. No ifs, and, or buts. I don't know if that helps, but I'm just trying to put it to scale.
Yeah, that helps. Thank you.
Sure. Well, thank you all very much. It was a pleasure. I hope I helped a little bit, and I hope I answered your questions and got some thoughts. But try to think about breather's disease. It's an interesting concept, if you ask me. Thank you again.
Yeah, that was good information. I hadn't heard of that one before. I would just add my thanks to everyone for joining us for the call, and thank you to Dr. DiLorenzo, and hope everyone has a great evening.
Thank you, Chris.
Thanks.
Thanks for everything you guys do. Take care.
Thanks, you too. Bye.
Bye now.